All righty, so we are at 2 o'clock on the dot, and welcome to the ARC webinar series. This is going to be the second webinar that we've done. We did Rose and Aziz did a Medicare webinar about 2 weeks ago, and so that's just covering Medicare basics at a pretty high level, terminology, all that good stuff. So today we're going to be doing the individual 101. So again, very high level, might have some technical difficulties here. Call me good now? Yeah. Okay. Thank you. So yeah, so very high level, nothing too in detail or in depth. Just kind of going to be going over, again, terminology, what things mean, hopefully just broadening and expanding the knowledge of what the individual market looks like and all that good stuff. So go ahead and get started here with the first couple things. If you do have any questions, feel free to just type them in that chat box down there on the panel, and we'll just try to get to them after we get through everything and do our best to answer them. I think Dale and I hopefully have enough knowledge between the two of us to answer any questions. So no questions are dumb questions, so just feel free to throw whatever in there, and we'll get to it here at the end. So I'll just introduce myself first here. So my name is Jake. I have been here since 2017. Been in the, business or industry since 2015. Started at Anthem as an intern while I was in college, so got licensed and appointed with Anthem as a junior in college. Did that for a couple of years. Graduated, and then obviously made the jump here. Been here ever since 2017, and glad to be here. Glad to work here. Love everybody except this guy sometimes. As far as myself outside of work, spend a lot of time with my family, my dog down at the lake. We do a lot of boating, trail riding, hiking, different things like that. Enjoy playing soccer as well. But other than that, I'll let Dale introduce himself here.
Yeah, my name is Dale Geis. I have been here at Cornerstone ARC Benefit Solutions for about 7 years now. Really enjoy it. Great place to work. Good people. Overall, I've been in the insurance business since 2004. I spent a lot of time as an independent broker. I too worked for Anthem for a while and wound up here. Absolutely love it. Outside of work, basically spend the time with the family. 2 daughters in college, so it's just my wife, myself, and 2 dogs at home right now. So you'd think it's more relaxing, but it's really not. So, very nice to meet y'all.
All righty. Oops. All right. So before we get into just all the info, wanted to throw this in here. If you did want to join the monthly newsletter that our marketing team does, the email down there, news@arcbenefitsolutions.com, just kind of a good way to get info about the industry. I think they do a lot of different tips or did you know type of things. So just some general info, kind of keep you up to date on what's going on. And obviously, like it says, their health, wellness tips and different things. So feel free to do that if you would like. So kind of what we'll go over today. Again, we'll go into more depth on each of these. Nothing too crazy. We're trying to keep it as general. Nothing plan specific or plan detail specific, but just kind of again the way the market goes or the way the market works, what's out there and all that good stuff. So characteristics of on-exchange marketplace plans, off-exchange, kind of an alternative option to those plans, the short-term plans that are out there, how plans are priced, again, between short-term and ACA, different enrollment periods that are out there, so certain times in the year you can and can't enroll, and then just some kind of things to consider, things to maybe look into or just be aware of as you're kind of working through this. And as always, if you do have questions on that stuff, obviously feel free to reach out to us with our contact info, or you can jump on the website, fill out a form, and it'll come to one of us here. There's about 6, 7 of us that all kind of do the same thing. And then lastly, like I said, Q&A. So anything that anybody has in the box there at the end, we'll be sure to go over that stuff as well. So All right, so starting off here, just some general info. The first bullet point there, as far as terminology goes, I think something that I hear a lot, I'm sure Dale hears, and again, everybody else hears as well from people, is just some confusion on terminology between ACA, Obamacare, on exchange, off exchange, healthcare.gov. So that first bullet point, when we're looking at on exchange plans, they all basically run through healthcare.gov. That's just the platform that everything goes through. It's also referred to as the federally facilitated marketplace. ACA is just the term or the acronym for the Affordable Care Act, or Obamacare is kind of I would say the slang term that people use to reference that. But all really one and the same thing when it comes down to it. As far as by the numbers, and we'll have a graph here in a slide or two, just kind of showing this, but 10.3 million covered in 2022 across 33 states. So that's 33 states that all run through the FFM, or that federally facilitated marketplace. Whereas on the other side of that, there's state-based exchange, where there's other states, instead of going through the federal marketplace at a federal level, basically the states take control of that, and the states do enrollment and eligibility and do all that. And the feds are not associated with them at that point. All right. What's that?
Some examples of the state-based marketplace are the closest one to us, Kentucky. They just went back to their own exchange this year. Other examples are like New York, California, I believe New Jersey, Virginia. There's several of them out there, but the only one that we deal with really in this region is Kentucky. It's called Connect, and it's back new this year. They started with it, moved to the marketplace. Now they're back to having their own.
All righty. So here's just a quick graph over the years. I think it was 2014, right? When
2014 when it started.
All right. So if you look at that, I think looking at 2014, I'm not 100% sure why the enrollment numbers were so low. I'm sure due to some just uncertainty, confusion, not really knowing what's going on.
Difficulties.
Yeah, that as well. And then obviously over the years, relatively steady, and then jumping from you see there 21 to 2022. Kind of, I guess, important note on that, and I think we'll down here later on in the PowerPoint, we'll get more into that. But there was a significant jump from last year to this year due to some increased subsidy eligibility, which again we'll get into. But just they kind of show from its inception to now the numbers and the growth and all that. So anything you would want to add on to that?
Nope.
All righty. So as mentioned, I think on that second or third slide, we've got really within the ACA on exchange and off exchange plans, and so we'll kind of again briefly break down the differences between those, and just kind of as you're deciding, hey, what direction do I want to go? Some important things to consider, and hopefully we'll be able to explain those differences and just show you, what each path looks like. So starting off with some on-exchange facts here, and just some general background info. The on-exchange plans are basically required to cover 10 essential health benefits, and I believe they have to have all those right to be approved and be offered on the marketplace.
That's actually for all Affordable Care Act compliant plans on and off exchange. Later on, when we get into some of the outside of this exchange options, like the short terms, those do not have to include all 10 essential health benefits, but all on exchange and off exchange Affordable Care Act compliant plans must include those.
Yeah, so you can see a couple, I think that's all 10 there. Hospitalization, ambulance, ER, maternity, mental health, RX, lab, preventive, pediatric, and rehabilitation. So all those plans are going to have some level of coverage in there. I think the most notable one, or maybe the one that we come across the most or have the most conversations with people about, is going to be either preventive care, which is basically covered at 100% on any of those plans. Maternity and hospitalization are probably two of the other big ones. But all the plans will have that. And as far as looking at Ohio in particular, that's really probably what 80 to 90% of what we do. So not going in too much depth for Ohio, but just because it is our biggest state. There's 10 different insurers in Ohio. We'll kind of again break that down as far as where they all line up, or where they offer plans, or how they offer plans, not necessarily who, but all right. So underwriting here, one of the biggest things I think why they wanted, when they passed the Affordable Care Act, was to essentially guarantee issue policies to everybody. There's no sort of underwriting, no sort of medical conditions, that are going to prohibit you from getting onto a plan, or have any sort of coverage denied for any sort of existing condition, anything like that. And as far as how the rates are kind of derived, again, going back to the no medical questions, rating is basically going to be, based on your zip code county, so where you live, age, gender, smoking or tobacco use, and then if there is a subsidy, available based on income. That's something we'll jump into later. But as far as just the base rating, I guess you would call it, those few demographic info pieces there that really kind of create the rates for everybody. So something else to note there, tax penalty. So some people are aware of this, some people are not. Part of the Affordable Care Act when they implemented it, and it's also called the individual mandate, right? So another term, which I think is also laid out in here later on, but that law, when it was initially passed, or that piece of the law when it was initially passed, said that you had to have quote unquote compliant coverage, as deemed, I guess, compliant under the Affordable Care Act standards. So that law, or that part of the law, is still written, but it's not currently being enforced. So previously, if you did not have compliant coverage, so an Affordable Care Act plan, an employer-based plan, something like that, then you could potentially take on a tax penalty, a tax time when you filed. So something else just to note there. And then the fact here on the side, 260,000 Ohioans are enrolled this year, so it's about 2% of Ohio's population. I believe that's about on average with all the other states across the country, give or take. So just a quick tidbit there.
And then in 2022, there was a nominal increase nationally of around 3.5% average. That will differ year to year. A lot of it depends on one year. You might see one carrier jump more than another carrier. Like this year in Ohio, we have one of our carriers take a significant jump, and one of our carriers actually reduced their rates in large areas of the states. So a lot of it has to do with they have to pay out 80% of what they take in towards the cost of taking care of their clients. The insurance companies do. So if they haven't spent their whole 80%, they've got to figure out a way to get that back into the client's hands, whether it's through reducing the cost of the insurance the next year, or possibly sending out some type of payout, which is probably never going to happen. So it generally is reflected in a decrease in the rates for the next year. And the ACA is available for any age individual, primarily from 0 to 65. It's very rare that it's available to someone over 65, but in some very unique cases it is, basically because you cannot have an Affordable Care Act compliant plan at the same time that you have Medicare or Medicaid. So that would make you ineligible for those. And then as far as the ACA is available for any income level, nearly all income levels can receive a subsidy now with the expanded, except for the very, very top end. What we're hearing this year is that may possibly go back to the way it was, where there's more cutoffs, but pretty much if you're above Medicaid level, you'll be eligible for a subsidy until you get to a specific number. The tax credits can either be taken on a monthly basis, which reduces the cost of your plan on a monthly basis, or you can receive that tax credit at the end of the year on your tax return if you're unsure about your income throughout the year and you want to play it safe. We always recommend that people estimate a little bit high. It's better to get a little bit back at the end of the year than have to pay back a little bit. So, and you must live within your county that your plan's available in, because believe it or not, crossing a county line, there can be plans that are not available. The rates change. There's a lot of different variables that are in there. And you cannot be enrolled in the Medicare or Medicaid like we talked about earlier. Enrollments are generally through the marketplace. If you're doing on-exchange, they're all done through the marketplace, healthcare.gov. You will receive a lot of communication with them, and you can also communicate with your broker or agent. That's what we're here to help you for, interpret all of that stuff. Open enrollment is generally from November 1st through January 15th, but in order to get that January 1st effective date, your enrollment has to be done by December 15th. If you go past December 15th, you'll be enrolled for February 1st.
Did they extend that? I know they did last year, but generally it was January.
Generally it's December 15th, right. But the last year it was through January 15th, and we haven't heard of a different chat this year.
Yeah, so if they do extend it, we probably don't hear that till what, late November, early December if they do extend it. So we try to, I think our big date is trying to push, or not just ours, but I would say, everybody, if they're looking for January 1st effective date, December 15th definitely is kind of that date to aim for. And if they do extend it, then obviously gives you some extra time or eligibility to enroll for another effective date. So.
And then the last thing in this section is just with the fact that the plans have no underwriting to them and they're guaranteed issue to all, you're required to sign up during open enrollment, or if you have another period of time throughout the year, which is called a special enrollment period, that is triggered by something like moving to a different area where your plan's not available, having a child, getting married, involuntary loss of coverage, aging off of a plan. There's a whole list of them. Again, that's something we can help you with. But because they're guaranteed issue, they don't allow you just to hop on it for no reason mid-year, use it for a couple months when you need to get treated, hop back off of it and hop on it. So it's either open enrollment or special enrollment period,
which we will go through here. So I don't think that's a 100% complete total list of all the special enrollments or qualifying events for a special enrollment period. I don't think we need to go into a whole lot of detail about each one of these. A couple of them are pretty self-explanatory, but I think the most common one that we see falls under that involuntary loss of coverage. So the first one there. So whether that be coming off of a employer-based plan, whether it's yours or spouse's, if you retire, change jobs or let go from that job, that's going to basically fall into that involuntary loss of coverage. One thing I did want to make a note on there about the involuntary loss of coverage is, and I'm sure you get this from people as well, but a lot of times people say, oh, if it's got to be an involuntary loss of coverage, what if I voluntarily leave my company, or like to change jobs, retire? It's all the same thing. You're regardless of if you are let go, you choose to leave, retire, whatever it is, all of that is still technically under involuntary loss of coverage. So just again, sometimes I've had that question from people, and they're just confused on the terminology between involuntary and voluntary. So that's probably the most common. Another there, the next one, individual plan renewing outside of open enrollment. I think that's really just referencing to the grandmother and grandfather plans that are out there. So plans, basically, again, not to get in the weeds on this, but plans that were out there prior to the Affordable Care Act being introduced and implemented. So if you were on a plan like that prior to the Affordable Care Act being implemented in 2014, it's a grandmother, grandfather plan. And so sometimes those plans don't run from January 1st of one year to December 31st of that year. So if, let's just say, for example, it's July 1st of this year through July 1st of next year, that's a non-calendar year renewal. So if and when that plan comes up for renewal in, say, June, July, August, sometime other than that 1/1 to 12/31 window, I guess policy year, then that is a non-calendar year renewal. That's not as common, but we do see that. Next, when they're becoming a dependent or adding a dependent, so really birth of a child, not a super common one, but do see that from time to time. But the important thing to note there is that is actually, and correct me if I'm wrong, but that's the only qualifying event that actually allows for a start date of the plan to be anything other than the first of a month, I believe. So something else that we'll get into later on, but that is the only one that will allow a plan to actually be retroactively effective to the date that the child was born. Everything else, every other qualifying event is basically going to push to the first of that next month effective date. The next, or do you want to go through them? Or?
Just the next few deal with marriage, divorce. So if you get married, you have a right to change plans with the new spouse. Divorce, obviously one of the two in the marriage is going to wind up losing their coverage through the other one usually, or a separation of assets occurs. So therefore, if they're both on a marketplace plan, they're no longer going to be on the marketplace plan together. So it will allow them to choose a different plan and readjust their tax credit. One important thing to remember about a few of these is even if, like, one we're going to talk about is a permanent move. So you move from Cincinnati to Indianapolis. The plans are different in Indianapolis than they are in Cincinnati, so you would be required to get a different plan. But if you were to move to Indianapolis and didn't already have a plan, you're not involuntarily losing a plan because you're moving out of the service area. So that does not trigger a window. So there wouldn't be a special enrollment period available at that point in time. You would still be waiting for open enrollment. And then becoming a citizen or a legal alien, that's a big one. Same with being released from incarceration. We don't have that on here, but
I don't think I've ever had anybody. I don't think I've ever had anybody answer yes to that.
But you're in a situation where you were not legally allowed to have the insurance, and once you are legally allowed to have it, it triggers an enrollment period for you. Again, those are considerably less common than someone changing jobs or leaving a job. Error in enrollment. That one is often very, very hard to get because a lot of times they'll tell people, well, you picked this plan, or, but a lot of that's something that we can work through and we can appeal. It's just a little bit harder to get them to allow that. The employer plan is over the affordability threshold. That is another one that there would have to be a significant change in the amount of cost there is for that to go over that. And one thing that is unfortunate about that they have not fixed yet, they call it the family glitch. And what happens is the affordability of 9.61% is only based on the individual that works there.
And that's 9.61% of the household income.
Correct. But that 9.61% of the household income, you include both incomes if both adults are working, but the affordability aspect only comes in on the individual that's employed there. For instance, if the household income is $50,000 and the individual for that person's is, say, $200 a month, $2,400, that comes in underneath. But in order to add the family to it, it winds up being, say, $700 a month. That goes to $8,400 a year. That would be over the 9.61. But unfortunately, they're only taking into account the individual who has the plan offered to them, who's employed there. So it's kind of like a glitch they've been trying to fix. Hasn't happened yet. May happen this year. Don't really plan on it, though.
If it doesn't make any sense, that's because it doesn't.
And then access to an ICRA, again, that's basically what happens there is an employer will change the way they offer their health coverage, and they will allow like a specified amount of money for an individual to then use. And if they're eligible for an ICRA, they're no longer eligible for the tax credit at the same time. So it creates that option of availability at that point, and it changes what's available to them, how it's available to them, and then also if they're getting an ICRA instead of a policy through work, that's triggering it as well. And then loss of income making you subsidy eligible. Basically, you're making $100,000, not eligible for one. You lose your job, and the only job you can find, you're going to make, $40,000, let's say, and all of a sudden you're subsidy eligible. You have the right to reapply with the new income and apply to get a tax credit from that point forward. And because of the loss of income and becoming subsidy eligible, tax credit eligible, you then have the option of switching plans as well.
And then just to actually add on, I'm not sure why it's not on here, but to add on to that last bullet, on the flip side, gaining income. So if you are below the threshold amount and you're on Medicaid, generally you see people on Medicaid due to income levels or certain circumstances. But if you have an increase of income and you report that to the state, so to Medicaid, they can at that point say you're no longer eligible for Medicaid because you're over and above that threshold. That should or will also allow for special enrollment period to enroll. You should get get documentation on that as well from Medicaid to enroll. The other thing, kind of blanket statement for a lot of these, if and when you go through an application process for using any of these, the application can request documentation. So that's something, again, that we're able to help out with. You do end up getting documentation kind of advising you of that. Hey, we need the application process or the application system needs certain documentation to show proof of, that you lost your coverage and when you lost your coverage, or, when your divorce was finalized and when your coverage ends. So, again, just something else to mention there for each and every one of those. So go ahead
and just to follow up a tiny bit on Jake's last 2 points. One important thing to remember, if you are on Medicaid and you start making more money, you have to take your cue from Medicaid to move off of Medicaid. If you leave Medicaid, that's considered a voluntary exit. Then you're not available or eligible for a plan until the next open enrollment period. Medicaid, they kind of have their own way of working things. So there could be a time period where you're on it, then all of a sudden you get a different job and they may say, well, we'll generally keep people on Medicaid for 12 months. Or, well, like with you're pregnant now, we're going to keep you on Medicaid until you've had the child. There are different varying factors. Just the key thing is you cannot voluntarily leave Medicaid and expect to get a marketplace plan, even if you leave during open enrollment, because you'll apply and then they'll say, you're still eligible for Medicaid, you can't get a tax credit, you need to go back to Medicaid. So you have to take your cue from them on when it's time to leave Medicaid.
All right. And then generally you also have 60 days from the event. Whenever that event takes place or you lose coverage, you have 60 days to enroll going from that date. So moving on here to what is a subsidy. So a couple different names here for subsidy, tax credit. You also see it referred to as APTC, which is Advanced Premium Tax Credit. So basically you're being supplemented a monthly discount each month to help offset the premiums for that plan. So let's just say, for a quick example, if you do have the plan and it's a $500 a month plan and your income qualifies you for a tax credit of $300, you are basically paying the difference of that. So your monthly premium is $200. The insurance company is being supplemented the subsidy dollars from the federal government. I think we briefly touched on that. The expansion of kind of the eligibility for tax credits from the 2021 American Rescue Plan Act. A lot more people started seeing subsidies with that increase, and it's still kind of yet to be seen if that is going to continue for 2023. So again, as we move closer to the end of the year, I'm sure there will be an update and we'll see stuff on that. And then, so Dale, I think you probably explained that this one here. You explained that a lot better than I do about how the second lowest cost silver plan.
Yes. The tax credit is, there's multiple things that come into play. Some of the biggest factors are it doesn't allow you to pay more than 8.5% of the household income. It's based on your age, the county of residence, and the second lowest cost silver plan available in that area. So they'll factor in multiple things that will bring it in. So if you're, say, in Hamilton County and Claremont counties right next to you, you're going to get different tax credits because plans are going to be different prices. The average cost is going to be different. It tends to be closer to a larger city. The cost of insurance is a little bit higher than a more rural area. So the tax credits are going to reflect that. And another big thing that we talked about briefly before, but with it all being community rated, every 45-year-old in your zip code in your county is going to pay the exact same amount for the same plan, except for if that individual is a tobacco user, and carriers have the right to add up to 50% based on the tobacco usage. Most don't add that much. Some don't add anything at all, but some do hit you a little harder than others.
And then just if you did want to do, subsidy calculation, as always, feel free to reach out to us or just put a request in through the website to get a quote. But there's also stuff online that you can use or go directly to healthcare.gov, and you can kind of estimate that just based on your household size, who's applying for coverage, and then putting in your income to show kind of what a rate might look like. And the other thing, the reason I think that one of those first terms that I mentioned is called the APTC, Advanced Premium Tax Credit, because you receive it ahead of time throughout the year in a monthly deduction rather than at the end of the year, which you do have the option to, but I don't think many people really do that. Very small percentage take it at the end of the year. Most people want to take that throughout the course of the year to help with their monthly rates. So the last thing to note that isn't really on here is that it will always, your income will always adjust when you go to file taxes. So for the coming year, or I guess for this year, when you file taxes in 23, your income, what you put on any application, will end up reconciling when you file on taxes. So if you're over or under, basically what you actually file for, if it's over or under what is on the application, you could get more of a tax credit back at tax time, or you could owe tax credit dollars back, when you file taxes. So again, that's something that we go over, on a daily basis with people. So if there's any questions, obviously feel free to put them in the chat box there, or obviously feel free to reach out. So kind of getting down into the plans themselves. So not much here, pretty straightforward. 4 metal levels, with the exception in Ohio, Kentucky, Indiana. There's really no platinum plans. They're all gold, silver, or bronze. And I think the best way to, or the reason they have them, set up that way is to distinguish the differences as far as out-of-pocket amounts go, deductibles, copays, your overall out-of-pocket maximum amount. Just like many other plans, not just health insurance, but you're going to have richer benefits. It's going to result in a higher premium. Generally, you see that on the gold level plans. So some silver level plans are can be pretty rich with copays, different things like that. And then obviously bronze plans there are going to be the lowest priced, higher deductibles. Some bronze plans will have copays in there, kind of what called first dollar coverage.
Yes.
So prior to the deductible being met. And I'll hit that last point there. So no platinum plans in Ohio, just the gold silver, bronze, and that is also true for Kentucky and Indiana as well. Anything to add on?
I was just going to say one thing to consider on all level plans. Preventative care is covered at 100% no matter what level plan you have. So if you're one of those individuals that goes to the doctor for their yearly physical, doesn't do much else throughout the year, your bronze level probably makes more sense. But that's something we would all discuss together, like once we start to look into everything. And that kind of leads into our next point, which is network consideration, which one of the big things is, and we will do this for you. Like if you call in, we'll obtain a list of your doctors, so we can check the differing networks, because there's a big difference in the individual plan networks, the Affordable Care Act plan networks, versus like a group network or a grandfathered plan network. The networks are slimmer. As of right now, there's no PPOs available in the state of Ohio. I think there's one available in like 2 or 3 small counties in and around Akron.
For the Affordable Care Act.
For the Affordable Care Act plans. That doesn't include work benefits or short-term benefits, anything like that. So we would just want to go through and verify doctors, hospitals, because you have a lot of separation in hospitals. The one that sticks out is Columbus. You've got, 5 or 6 carriers. One will have Ohio Health, a couple have Ohio State, a couple have Mount Carmel. So there's definitely separation. So there's things like that we need to verify as we go into looking for the plans. So all of them are going to have different networks. So you can't just expect, oh, I had Anthem on the group side, my doctor's going to be in there individually, because it doesn't work like that. So, but that's all something we go through in the quoting process.
Got everything on there? Yeah. Okay. Okay. And then medications and pharmacies. So just like a network, each of those plans, or really each of those companies, are going to have a formulary. So, basically how the different drugs that they cover are tiered. So basically it's I think all of them are 4 tiered for the most part. So tiers 1 through 4, starting with generic, preferred brand, brand name drugs, non-preferred brand name drugs, and then specialty. Obviously, going down that list, cost is going to increase with those medications as you get closer to specialty meds. Way to kind of help reduce possibly looking, or when you're looking at cost, is to do mail order. So rather than doing it, 1 month at a time, setting up mail order, getting, something like a 90-day supply, and going about it that way. Just like the actual doctors, hospital, provider networks, medications do still need to be filled through a network pharmacy. And I think, all those carriers for the most part are going to have a lot of the big names, CVS, Walgreens, Rite Aid,
Kroger.
Walmart, Kroger. So I don't really think I've ever had anybody come back to me and have an issue with the network. I mean, maybe it's a medication that is or isn't on the formulary, or something was updated. But I don't think I've really ever come in contact with someone specifically asking about a pharmacy network. So usually pretty easy there on medications. And pharmacies, it's also something that, we will look up, especially if it's a specialty type of drug. Most of the time generics across all those carriers are covered pretty similarly. So not a whole lot of difference, in generics, but definitely specialty drugs are worth looking into. So. All right, so then quickly to kind of pivot to off exchange, not a lot of difference, between off exchange as far as the biggest thing there being they're not subsidy eligible. I personally don't do a lot of stuff off exchange. I don't know if you do, but I think especially now this year with the enhanced subsidies, a lot more people are qualifying for subsidies, so it makes a lot of sense to probably go that route and at least look and go through the process. If you've got any examples on why you would do on exchange versus off exchange, if it's not coming down to the subsidy, I don't do it.
Generally, the only reason you would want to necessarily go outside of the exchange or off exchange for an Affordable Care Act plan is if you're well clear of any possibility of a tax credit, which there are a lot of people that are, and there are a couple spots in the state of Ohio where there are some slight discounts on silver level plans that are off exchange. The Columbus area has a carrier that goes a little bit less expensive on those, but that would be something we could run over with you. So it's always wise to check and see if it's going to be less expensive. But one of the big factors is, say if you have an Anthem 5500 bronze plan, it's an identical plan on exchange versus off exchange. The network's identical, the payouts and everything are identical. The only difference is one is eligible to have a subsidy applied to it. The other one is not going directly through Anthem. So there's not a ton of difference there. And so generally, stuff goes through the exchange. There is the very rare occasion where we would go off exchange.
All right. And then to kind of pivot, I would say to the kind of alternative option from the Affordable Care Act plans is going to be short-term coverage. We'll get into kind of, I guess, a couple side-by-side comparisons here in a few slides, but just to quickly go over these and just some general info. So they are short-term plans because they can only be written, I guess, well, depending if you do a renewal, but we'll just put the basic term there, the short-term plan, meaning 364 days. In certain states, and also in Ohio, you can do up to 2 years, basically back-to-back policies. But that's, again, something that just kind of depends on your situation if you want to do something like that. One of the biggest advantages to the short-term plans is going to be the PPO networks versus HMO networks that the ACA plans carry. You're pretty hard-pressed to not find a provider, hospital network, or I'm sorry, hospital or like physician network out of network in there. And even if it is, then it's PPO network, so you do have some network coverage there. The other notable difference is the fact that they can be significantly less than the Affordable Care Act plans if there is no subsidy eligibility. So that's probably the biggest reason we see people go that route is they're like, hey, I don't qualify for a subsidy, my income's too high, so we want to look at something else. And a lot of times those plans are and can be less expensive. And then they also can be, used to bridge a gap between, maybe you come off of a group plan, an employer-based plan, and you are, a year or two or 6 months, 3 months, something like that away from Medicare, to kind of bridge that gap. So, couple other differences between short-term and ACA. You do not need a qualifying event to enroll. You can do those really at any point in the year. The catch is that they are medically underwritten. So they do have health-related questions. It is not a guaranteed issue product like the Affordable Care Act plans. So basically when you go through the application, there are about, depending on the carrier, 6, 7 yes, no. Health-related questions, nothing crazy there. Just yes, no questions in order to be, eligible to get onto the plan. The biggest drawback to the short-term plans is that they do not provide coverage for pre-existing conditions. So really what they mean by that is, let's say you were looking at you needed a new plan for August 1st, and we write a plan for August 1st, effective date, anything prior to that you've had testing, treatment, medication, diagnosis for is going to be considered pre-existing. And basically those plans will not provide coverage for those. So again, not for everybody, obviously because of the underwriting, but it is a good option if you do qualify and kind of fit that, or it fits your situation, budget, all that good stuff. All right. Anything else you want to?
Nope, I think we'll hit pretty much everything else in the next. So as far as the big differences, the big comparisons, short term, you're gonna have a larger network, versus the ACA. But the ACA has a lot of really fine networks as well. So A lot of times that's not going to play too much into the decision, but for someone who may travel a lot more, the short term may come into play a little bit more, and just those that might want to save a little bit of money that aren't subsidy eligible. That gets on to the next one, ACA. You can get that subsidy or tax credit that can bring down the cost of your plan. And sometimes if your subsidy is large enough, it can bring down the actual cost of co-pays and stuff like that too. Whereas short term, you're never going to be eligible for a tax credit. With the ACA, you've got comprehensive coverage. Basically one of the big differences, like the coverage limitations on the short term, on the ACA, you don't have to worry about pre-existing conditions, and your preventative care is covered at 100%. 99% of short-term plans do not cover anything towards your preventative care. So on the ACA, you need a physical, your yearly mammogram, something like that, covered. Short-term, it's not going to happen. Well, it can happen, but you're just going to wind up paying for it. There's no qualifying questions for the ACA. The short term, you're going to have to qualify for it. The ACA is going to give you prescription coverage. It's one of the 10 essential health benefits. Short term, there is going to be some prescription coverage built in a lot of the plans, but one of the key things is we keep talking pre-existing conditions. If you're taking a medication because of a pre-existing condition that doesn't prevent you from getting the plan, that particular drug would not be covered because it would be considered part of the pre-existing condition. And then one of the bigger things too is the ACA. You're going to have your enrollment periods or special enrollment periods. Short term, you can apply anytime throughout the course of the year. You can apply for anywhere. Well, differing states might have a double term or a tri-term like Kentucky has, but for the most part, it's a 364-day plan. They're actually great if you want to get one in between jobs and you need it for 45 days. You can just set up a single payment, just have it all done at once, and it just ends itself. So, that's a positive to the short term.
Yeah. And then real quick, just to kind of, on the back side of this whole comparison here, just to kind of show some test rates. At different deductible levels for a 30-year-old and a 55-year-old in Lucas County, just a couple random ages in a county to show you the rating difference. And I believe all these ACA rates are going to be unsubsidized. So this is just base rates that are based on your zip code, county, date of birth, and then if you're a smoker or not. So that's really all that's going into these. I think these are definitely actual rates that somebody had ran as kind of a comparison, just to kind of show what the difference looks like. It can be pretty significant. Again, if you take into account, hey, we're getting a $600 a month subsidy, and on an ACA plan, and you want to do whether it's a $5,000 deductible, whatever the deductible level is. If you have a $600 subsidy, you're going to eliminate the entire premium there on an ACA plan. Greatly reduce the other two, there with a subsidy. So it just kind of depends on that. Obviously, again, like we've said, that's something that we're able to help out with, go through, or you can go also to healthcare.gov and do those calculations for you as an individual or your family, and you don't have to sign up for having an account. You can just go on there. So last couple things here near the end. Ancillary coverage. I think a lot of times people, when they come off of group plans, they've got dental, vision, are probably the two biggest. We are able to look at dental, vision stuff as well. Usually I'd say it comes down to the individual or the family if it makes sense. Dental can kind of be hit or miss, depending on how much you use it. Same thing with vision. It just kind of depends on your usage. If you have things ongoing, a lot of times people would say, hey, I'm going to go without, dental or vision coverage, and I'm going to go without dental and vision coverage because I go in once a year, maybe twice a year. It doesn't make sense to pay for the plan premium, and then also have a deductible to meet or something like that, a small deductible. But again, just depends on usage. Critical illness and accident plans are also great. I wouldn't say we do a ton of stuff with them, but definitely a good tool to maybe have in your back pocket if you have a large deductible, say, on a bronze plan. So all the bronze plans are going to have higher deductibles, and those are nice where, it's a quick example. Hey, I was in the hospital for 2-3 days. My accident plan says, hey, we'll pay you, $500 a day for every day that you're in the hospital, and they can basically supplement you those dollars, and you can use those to pay towards the high deductible of your policy, or whatever plan that you might have. They are all standalone, so you don't have to actually be enrolled in in a medical plan, whether it be ACA or short term. You can do that stuff on its own. And some of the ACA carriers do have dental and vision hearing benefits included in them, and I think there's some of the dental and vision carriers have a small hearing piece in them, very small, nothing crazy. But
particularly some of the dental plans will have, like, an example would be Dental Care Plus. They've got a little tiny bit of vision and a little tiny bit of hearing built into their plan. So if you're mainly looking for dental, but the other stuff would be like, oh, I wouldn't mind going to the eye doctor every couple of years just to keep track of my eyes, that would be a good plan to get.
All right. So this is all, I think stuff we've probably already covered all of, just between the two. Again, open enrollment versus any time throughout the year with short term. Special enrollment periods don't need to have any sort of qualifying event. On the ACA plans, coverage can usually begin the first of the following month. Coverage on short term can start the next day. So it just kind of depends on your situation, when you're actually losing coverage or when you need new coverage. And both of those options are good options. It just really depends on each individual or each family situation. There's not necessarily a right or wrong answer. Just kind of depends on a couple different variables. So. And then how to enroll. This is, I think, just for ACA. So healthcare.gov. You as a consumer are able to go onto healthcare.gov and do an application completely on your own. If by chance it does happen to be with us or any other agent, broker, somebody like that, it will flow through healthcare.gov at the end of the day. So, the biggest thing is, if you do go through it on your own, just, be sure to answer those questions as honestly and as accurately as possible. They will, take into account stuff for like tax credit info and your discount in there if you are subsidy eligible. So just be, aware of that. Once you go through and submit, it will, technically be final, but it can be updated throughout the year. The other big thing there is premiums are the same no matter where you go. So again, if it's us, somebody down the street, you do it on your own. You call healthcare.gov to do it. It's going to be the same rate. The only thing that can drop those rates down is going to be if there's a subsidy based on income. So I guess that last point is important. If you are talking to somebody about enrollment fees, there are technically no enrollment fees when you go through healthcare.gov. There's nowhere at all in that application where we check or read anything that says, hey, by agreeing to this, the client or the consumer is obligated for an enrollment fee or something like that. So start hearing stuff like that, again, feel free to give us a call, and I'm more than happy to help. So.
And then another big thing to do is just kind of do your homework, kind of have an idea. As brokers, we will help you, go through everything, but have an idea of, hey, I'd really like to have no more than this as a deductible, or pay no more than this. Make sure you talk to your broker, whether it's us or someone else. Verify the doctors, verify the medication costs. Just kind of make sure the plan fits all the way around. Because honestly, everybody wants the lowest deductible, lowest co-pays, lowest everything you can have. But being 100% honest, most of the time going with a gold level plan, you're overpaying for what you're getting. You're going to pay too much more per month for the plan than the actual extra benefits you're going to get out of the plan. So just kind of know where you want to be, because in all honesty, it's not a benefit if it's a struggle to pay for it. You know, so you want to have something that fits the budget, something, you bring your deductible down if you can, but don't overpay to bring your deductible plan. So kind of have an idea of what you're looking like when you go in. So as you talk to a representative, a broker, whoever you're talking to, you can both stay on the same page. And it's very important to make sure your doctors are in network, your medications are covered the way you want them to be covered, or at least covered as well as they can be. Because again, dealing with the ACA plans, once the year starts, if you get into February and you decide, well, I would have really liked that doctor in network, you don't have the option of changing until the next year unless you have a special enrollment period. So kind of talk with your broker, go through it, get on the same page and just do your homework.
Okay. And then just, I guess, this is actually probably for us as well, just things to consider, things to look out for as we kind of approach the next year. Just the way healthcare is obviously has been over the years a political hot topic and something that's bounced back around. Been a lot of changes. The previous administration, they repealed here the individual mandate, which was that tax penalty. So that was a very big thing that the previous administration did. I think within the first year or so that they were in there. So that was a big deal. This is going to be a big deal here coming up again, going into next year. Something that we're still unaware of if the increased subsidy eligibility is going to remain for 2023. It's really going to affect a lot of people if they don't keep that in place going into next year. Not to scare anybody, but that it can or would affect a lot of people in a large way if they go back to the way it was previously. So again, just some questions that maybe be thinking about as we approach the end of the year with budget, different things like that. Last couple things there. Will insurance companies continue in the ACA? So I think just, our company is going to stay in the state. Are things going to change? Are people going to leave? New people come in? Again, as we get closer to the end of the year, to open enrollment, we start to see those things kind of come hit the headlines and we know more as we get closer to the end of the year. The other kind of, to go back one slide real quick, about doing homework, we ask people to get a hold of us as early as possible, once we get around those last 3 months of the year. But in reality, we don't ever see anything, the market doesn't see anything officially until about, the last week of October.
Yep.
So we're in the dark up until that point as well, but we do our best to, get everything out and start doing that stuff as soon as we get it all. So, I guess so that last bullet point kind of ties into this one here. If the individual mandate makes a return, that'll probably, I'd say, push some people away from short term, because if you go that short term route and this individual mandate is re-implemented, then you could potentially take on that tax penalty. So just some changes to maybe think about, again, stuff that we think about or need to be aware of as the year goes on. So anything else you want to?
Nope.
Okay. All right. Well, that does it for what we have. And bear with me, this is our first time jumping on and doing one of these, so I am let's see here. Can I close that down? Oops. All right. If there are any questions, feel free to put them in the chat box. More than happy to answer any questions. And I think I'm looking at this right. Okay, that was just okay. So if there is anything else, feel free to put it in there. Here's, again, Dale and I's contact info. You can also go out to our website down here, fill out a form for like a quote request or something like that. More than happy to go through that with you, or if you have family friends, more than happy to help them out as well. So I think other than that, I don't see anything else in there. Trying to navigate my way through here. All right. Well, I think that's about it. I don't see any questions in here. So I appreciate everybody and anybody's time, and hope everybody has a good rest of their day, and appreciate your time.
Thank you very much.